RFK Jr. just cut $500 million in funding for mRNA vaccines. The scientific community is pissed off, I'm pissed off, and if you're not pissed off, you should be. This is an unbelievably reckless decision from the head of the top health agency in the US, who holds incredible influence in biomedical progress for the whole world. This move will have direct consequences for years to come on our ability to prepare for the next pandemic, the economy, and your health. As a scientist who spent years studying mRNA vaccine technologies, I am incredibly passionate about why this is such a bad idea. Hell, anyone with even a basic understanding of science and medicine understands that mRNA vaccines have benefits that greatly outweigh their risks. So if you want to understand how this directly impacts your well-being, as well as the critical reasons, both scientific and financial, of why RFK's decision is so misguided, you'll want to stay until the end of the video. Let's start with the what. On August 5th, 2025, the Health Secretary of the USA, RFK Jr., announced a cut of $500 million in funding for mRNA vaccines for infectious diseases like COVID and the flu. This wasn't some minor adjustment. This funding was spread across 22 major projects, all aimed at preventing the next pandemic, from early stage research to large-scale manufacturing. He announced this in the video on his Twitter account, trying to justify his decision. I'll link the video down below if you want to see the full thing. The gist? He claims mRNA vaccines don't prevent upper respiratory infections like COVID and the flu. They have more risks than benefits, and they can even supercharge viruses to mutate more, which can eventually prolong pandemics. He cited experts at the NIH and the FDA, assumingly not the same ones that he fired just a few months ago for absolutely no reason, who supposedly advised replacing mRNA vaccines with safer and broader vaccine tech. And he insists that he's for safe and effective vaccines, but they have to be the right ones. We'll go over the scientific validity of these claims in just a second, but first let's finish setting the stage. Let's make this clear. RFK Jr. has been anti-vax for a very long time. It was the cornerstone of his campaign. And even before he ran for health secretary, he has spent decades funding anti-vaccine groups and spewing harmful anti-vaccine rhetoric. Now, he has changed his tune a little bit recently. He says fewer outright anti-vax things, especially when compared to when he first got into office. But he's also been using that logic fallacy where he says, "I'm all for safe and effective vaccines, I just haven't seen any safe and effective ones yet," while conveniently ignoring all of the safety data that's been generated from millions and millions of patients over the last few years. What's that called again? Despite him claiming that he's okay with vaccines, it's impossible to ignore that these claims aren't a part of his anti-vaccine agenda, given his dirty and disinformed past. But okay, fine. Let's imagine there's a world where RFK Jr. doesn't have this big anti-vaccine agenda. Is he actually reading and understanding the science? Is he right? No, not at all. This next section of the video will focus on his specific claims about mRNA vaccines and see if they hold up in a court of law. The laws of science and research, of course, where I am the devilishly handsome but unbelievably dorky judge. But he should be fine. You know, RFK Jr., he says he's read the science and he understands the science, so his scientific claims should be ironclad, right? Right? Now, before we dive in, let's all get on the same playing field here and talk about viruses. We can't talk about vaccines without talking about the tiny little invaders that made us develop them in the first place. When a virus attacks your body, it's your immune system that is your first line of defense. But if your immune system is caught off guard, the virus uses that opportunity to make you incredibly sick. In order for your immune system to work, it needs to be trained to recognize the enemy before it strikes. Vaccines are the immune system's #1 training resource. You see, a normal vaccine is just a harmless version of a virus. It could be the inactivated version of a whole virus, which we'll get to later, but often it's just a small part of the virus, or a single protein on the outside of the virus that allows the immune system to recognize it. When this vaccine enters your body, your immune system gets activated and says, "Hey,
That's a bad guy. If we see this bad guy again, we're gonna go and kill him before he does any harm."
So now that your immune system is trained, it's prepared to respond quickly and effectively when it meets the real virus, therefore being able to kill the real virus. So in turn, vaccines reduce the severity of the illness, or ideally, completely prevents you from getting sick in the first place. So where does mRNA fit into all this? Just take a peek at this boxed part of this diagram. You'll see that mRNA, or messenger ribonucleic acid, serves as a set of instructions for building these things called proteins, which then carries out a specific cellular job. Now, I just want to take a second to remind everyone that all of your cells have mRNA, and all of your cells are perfectly happy to translate that mRNA into proteins. So in case certain people are trying to scare you with 4 teensy tiny letters, Just know that it is a very natural part of life. The mRNA in these mRNA vaccines specifically code for a viral protein, which you might have heard as the spike protein. Rather, one of the proteins from the outside of the virus that your immune cells can bind to and detect. And this is really nice because it means we don't have to give our bodies a whole virus in order to detect future viruses. We just need one tiny strand of mRNA that mimics the detection part of the virus and then inject it into your arm. Easy peasy.
No, apparently it's not easy peasy.
Buddy Guy Jr. says that mRNA vaccines are ineffective. That's funny because I'm pretty sure the vast scientific community says that mRNA vaccines are effective. So let's do this speed round style and really quickly go through some of the most important scientifically backed mRNA vaccine facts. The first mRNA COVID vaccines were shown to be 94% effective at preventing COVID infection. People who were not vaccinated were significantly more likely to experience symptomatic COVID and severe outcomes compared to those who were vaccinated. Some studies estimate that the unvaccinated were 10 times more likely to get COVID. Populations who were more susceptible to being hospitalized, such as people above the age of 65, were 30% less likely to be hospitalized when receiving additional vaccine doses. And finally, mRNA COVID vaccines were most effective in people who gave this video a like, subscribed, and shared it with their cutest friend.
Wow, who did that study?
And sure, these initial protection rates might have waned a little bit now that the SARS-CoV-2 virus has mutated a bajillion times, but there's still lots of data done on millions of patients that say yes, mRNA vaccines are effective and they save millions of lives globally.
Oh, well, the Kenster doesn't think so, and he definitely knows how to read science.
It's funny because he even takes it a step further and says that mRNA vaccines can actually make things worse. Stinky Bud Jr. thinks that when the mRNA vaccines and the COVID virus are in your body at the same time, that the mRNA actually causes the virus to mutate. And this is straight up false. mRNA vaccines don't actually interact with the genetic code of the virus. There's no substantial scientific evidence that says that it can increase the amount that this virus mutates. Where we can give RFK Jr. the slightest morsel of credit is that viruses do mutate. Basically every time the COVID virus spreads, there's a chance that it can mutate, and it mutates to try and increase its chances of not being destroyed by the immune system. It's the virus's way of trying to stay relevant, even though the newest trends don't fit their niche. And in the case where a virus does mutate quickly, like with COVID, you'd probably want the vaccine technology that you can make and change if you need to very quickly and efficiently, right? And that is one of the many beautiful things about mRNA vaccines. You see, making mRNA vaccines is relatively simple. Take the mRNA, mix it with some fats into a tiny protective ball called a lipid nanoparticle, also known as an LNP, purify it, and voila, ready to give you a red mark that lasts 2 to 7 business days. Now compare that with the other vaccine technologies, the ones made from actual whole viruses. You have to grow cells in a dish, then do dozens of specific filtration steps to isolate the fake virus that you do want from all of the cellular junk that you don't want. And then finally inactivate it so that that whole virus doesn't make you sick. Now on the surface, this might not seem like a big difference. It might seem kind of complicated either way, but top vaccine agencies in Europe says that it could take an extra month to develop these whole virus vaccines compared to mRNA ones. And this report from Sigma Aldrich clearly shows that mRNA vaccines use much faster, simpler, and more flexible manufacturing processes. In contrast, whole virus vaccines demand really complex facilities and a much more intricate process. So in the scenario where you have to make vaccines for, say, the whole world, wouldn't you want to use the vaccine technology that is much quicker to make? A normal person would say yes, but RFK Jr. would say that these slower whole virus vaccines are the way to go for some reason. But the absolute funniest part, like really, it is a knee slapper, is that the discombobulator claims that he is for safe and effective vaccines, which is why he is going to be investing into new vaccine technologies. The mRNA vaccines are the safer and newer and better vaccine technology. Oh my God. Like the data could not be more clear. mRNA vaccines are at least as good as the whole virus vaccines that he wants to develop so badly. And in many cases, they're actually better. Look at this report from Clinical Infectious Diseases. They reviewed and compared over 2 million patients from studies from all over the world that use both mRNA and whole virus vaccines. mRNA vaccines have a 10 times higher immune response than the whole virus. And the whole virus was almost 7% less effective at keeping people out of the hospital after a COVID infection. What I'm trying to say is all this is the whole point. mRNA vaccines were made to improve on the limitations of these older vaccine technologies and make them safer, quicker, and more effective. If he's making decisions based on the science, he needs new science. But what exactly are the ramifications of this decision? What happens next? The first thing I can think of is not just its effect on the US, but the rest of the world. I'm Canadian. I could give a damn if this was just insulated to our naughty neighbors down south, but it's not. As the biggest funder of biomedical research in the world, when the US cuts $500 million of funding, it affects how all of us can prepare for the next pandemic. And even if the US government does redirect that funding to other vaccine technologies, they will be for slower vaccine technologies, which if you remember during COVID, we were counting down the minutes until we actually got a vaccine that we could all take. This decision also sets a very dangerous precedent for other mRNA technologies that aren't vaccine related. For example, I recently made a video on baby KJ, video's up here if you want to check it out, who just received a personalized gene therapy. His personalized therapy was based on an mRNA LNP, the exact same technology that's used in the COVID vaccine. But now imagine if this funding got cut before baby KJ was able to receive his treatment. He might have been another child who passed too soon. And that's just the tip of the iceberg. That doesn't even include other exciting mRNA technologies such as cancer vaccines or stem cell therapies. I've got future videos coming out on what those are and how they could also change the landscape of medicine, so be sure to subscribe if you're interested in hearing more about them. Funnily enough, RFK Jr. did actually update his statement and say that other mRNA technologies such as cancer vaccines are still being decently funded, but given his track record, we'll see if he actually follows through with it and what that actually means. And finally, I think we need to consider the burden this is going to put on our healthcare system. With less access to quick and ready vaccines, we should expect to see more hospitalizations for severe COVID and flu symptoms. This is going to put more strain on an already exhausted healthcare system and exhausted healthcare workers. On the surface, I can't lie, things look pretty bleak. But us scientists are resilient. We'll find a way to get through this governmental bullshit and produce the best vaccines that we can. And who knows, maybe they'll lead to vaccine technologies that are better than mRNA ones. But one thing is absolutely clear. RFK Jr. is a dangerous man to be leading the HHS. At the time of recording, he's not even 6 months into his term. He has a lot more time to do a lot more damage. It's our duty as people who actually give a fuck about science to stand up to morons like RFK Jr. and make sure that this stuff doesn't keep happening. So my ask for you today is to vocalize your disdain for this anti-science rhetoric. Hop on social media, correct someone who's woefully misinformed, gently guide your loved ones who aren't scientifically literate to actual good scientific resources. And don't forget to like and share this video so the algorithm knows to push this to other incredibly handsome warriors against anti-science rhetoric. But that's all for me today. Thank you all so much for watching me rant like a crazy prick, and we'll see you later, nerds.